G'day, I'm Dr. Sam Hay and today we're talking about meningococcal disease. So meningococcal disease is caused by a bacteria called Neisseria meningitidis. Now it causes two main, clinical syndromes. One is the meningitis, when you get an infection of the lining of your brain, and the other one's septicemia, when it gets into your blood and it overwhelms the body. And that's when you get the classic rash. Parents need to worry when the kids are going downhill, when they're getting floppy, drowsy, listless, when there are fevers that are just not settling, when they're becoming unconscious, when there are breathing problems, vomiting that won't settle, bad dehydration. These are all signs that you need to get medical care quickly, call an ambulance or head into your doctor. There are 5 main strains of meningococcal disease: A, B, C, W and Y. Classically in Australia, we've had mostly sort of A, B and C. Now since the C vaccine came along, those numbers have basically gone. And so B and now the W strain are most common. Vaccination for meningococcal disease is very important. The C strain vaccine has been added to the nationwide immunisation schedule, and all kids will get that when they're 12 months old. But some new vaccines have come along for the B strain, and that's commonly called Bexsero. In the last year though, we've also seen the W strain increase. So have a chat to your doctor about whether or not you want to get protected for the B strain and maybe even the W strain.